Welcome back to Good Morning Vail. We're continuing our topic, talking about kids and education. And right now we're going to talk a little bit about a health education for your kids, the dentist. Dr. David Maloley joins us now. He's with Vail Valley Dental Care, and he's going to give us some great tips on what you parents should know and some different ways to get the kids to like the dentist. Because let's face it, you're a great guy, David, but there's a lot of kids that are afraid of going to the dentist. There's a lot of adults that are afraid to go to the dentist.
You're exactly right. I think dental anxiety is largely associated with dentistry, and that's the importance, I think, at the root of getting children a good early start at the dental office. A cliche I use often is mental health is more important than dental health. In reality, they're both important, but if a kid is anxious and resistant to the kind of things that we can provide them as far as preventative care, then that usually means more reactive care and reacting to holes in the teeth and cavities and that sort of thing.
Well, and I think things have changed so much in the last few decades with, pain management as well as just all the fun things there are at the dentist. I mean, we even have a few of the tools that you guys use, just some of the books. Sesame Street, very familiar to the kids, but Ready, Set, Brush lets them know that this is a normal part of being a kid.
Right. So we kind of use these all as educational tools to help parents pump their kids up to come to the dentist. So we use things like Mojo the Monkey here to go out in schools and educate, but it's a team approach between parents, the dental office, and kids to make sure that they're getting the right start. And with these sort of books, we've seen parents get their kids so excited that they wake up the morning of their first dental visit and say, "Is this the day I get to go to the dentist?" So
oh my gosh,
that's the start we want. That's the start we want for kids.
It is definitely, and you know what? Health for everyone. With higher healthcare costs, everything else, if you can start off on the right foot with your teeth, it can mean just volumes of, the preventative maintenance now can prevent you from having to do a lot of work later on in adult life.
You're absolutely right. That's the point we want to get with all patients, but especially kids, where we're thinking preventatively as opposed to, like I said, reactively. So there are a lot of things to make brushing fun, like this Sonicare toothbrush. We do a lot of games. This happens to play music, but you can use a little sand timer to make sure that the child is brushing. When we go out to the schools, we get them kind of repeating to us that they should be brushing twice a day for 2 minutes, and they go home and start to educate their younger siblings. So that's the mindset that we want the kids to have, is to know that this is a big deal.
And it looks like you do head out to the schools. Is that fun? Are they excited to see you and all the little things that you bring in?
The kids are amazing. They have the wisdom of kids is kind of always blows me away, but they ask the most incredible questions. I'm usually impressed with the amount of information that they have about what is a cavity creep, how do you prevent cavities from happening, that sort of thing. But you see enough silver caps and cavities and those sorts of things to know that there's still work to be done to make sure that kids are brushing their teeth appropriately, eating the right things, and making sure that their teeth are healthy, strong, and white is what we usually tell the kids.
Well, and also educating the mom and dads.
Yes.
Because that's one thing, is that they, let's face it, they have so much coming at them with having a new child, and even knowing at what age do you send them to the dentist. Tell us about this.
So that's probably one of the most challenging things with our job, is that parents that we see that are bringing their kids to the dentist are always well-intentioned, but there's a lot of myths about when do I start? Are these just baby teeth and they're going to fall out anyway? But the reality is the baby teeth are incredibly important. Besides the obvious of chewing and speaking and appearance, they also help develop the facial muscles. They hold the teeth for the permanent teeth. So some of these baby teeth we have to keep until we're 12 years or older. So the American Association of Pediatric Dentistry says first visit by age 1. I have a 1-year-old, and I would think it would be difficult to, even at home, to see his teeth and get a good look in his mouth. But certainly by 2 or 3, if we're waiting until there's any sort of dental discomfort or you see a dark spot on the tooth, it's usually too late. If we can get them in there and exposed to the sights and sounds, we do a lot of things to get them excited. I call it SpongeBob sedation. We put up a cartoon, and it kind of takes them to a different world. If we have to do dentistry, we can do laughing gas, what we refer to as moon gas, when the kid comes in. But it's the early start that's the important thing, to get the child exposed to the sights and sounds and everything that's involved with the dental office.
Okay, perfect. And David, we can get this free Kids Philips Sonicare toothbrush for new customers, right? New patients?
That's right. We've been offering this toothbrush, which is a top-of-the-line kids toothbrush. Their marketing angle is it makes brushing fun, and it's true. Kids kids like to use it, and that's available after a new patient visit for children.
Okay, all right. You can find out more 949-3331 or VailValleyDentist.com, and he's located right in Avon. We'll be right back.